Good morning. Mr. Chair and members of the Financial Recovery Board, when Board Member Newell indicated that we have to go up and take some water or go to the restroom, my thought was, well, I'll wait for you to come back.
That won't be long.
Because this issue, to me, is much too important to have a single board member not be here to listen. Jackson, as you well know, has gone through many iterations. And I think all of us remember so fondly our Clark and the fact that how Jackson was at one time before we got this beautiful campus and could not pay their bills and had to borrow even toilet tissue from across the street from the VA hospital. And Jackson has morphed into the nation, as far as I'm concerned, best hospital in the country. And I would hate to see us diminish that any further. I want to, first of all, commend this board for taking on and volunteering and coming up with recommendations and what you consider to be solutions to help Jackson become more stabilized. One of the things that we said on the commission when we approved for this board was that we did not want, just as the vice chairwoman said, we did not want Jackson privatized. And I even asked the county attorney, because it's in the item, that if the board, that 2/3 of the commission vote would be required to overturn any recommendation from the board. I asked the county attorney then, what if we cannot garner 2/3 vote and the Financial Recovery Board decides that they want to privatize and we can't garner the 2/3 vote? And the attorney said that would change the mission of Jackson and they cannot do it. Well, so you don't do the entire hospital, but you take the heart of Jackson. Over 70% of the patients who come into Jackson come through your emergency room. And so I see this as a backdoor approach to full privatization. Yes, we can say all we want, that we want to see what's out there, we're going on a fact finding. Well, the facts are already here, that you have an excellent staff, excellent doctors, excellent services, and if you need to make changes in your efficiencies of the wait time, then let's look at that and how we can best do that. And the best way to do that is to sit down with the people who are doing it every day and let them tell you. We're also, when I spoke to the CEO about this, and he understands how I feel, one of the things that was stated was that, a lot of hospitals around the country have contracted out their emergency services, and that we have it at the North Jackson. Well, look at the ratings of North Jackson. They're abysmal. They're very low. When you have over 70% approval rating for your operations here and the services that you receive, the University of Miami is in the process of bringing their emergency services inside and will be one of the applicants. And then not only will we go through the other issues that we have, then we're going to have something else. And we're constantly going out and trying to rely on other entities. And we run into problems with contracts when we do that. Let's not diminish the services. This hospital is destined, has always been destined, to be the last resort for the people out there who cannot afford services. Let's not experiment with those people and have them come here. And because we are privatizing to a for-profit, say to them, you may need this procedure, even though you may triage them and say, yes, you go see the doctor for the emergency services. But even though we're contracting to them, they will decide whether or not that person receives a service or not, or a test or not. And if it's a for-profit, things that can be prevented will be neglected. And I am very much concerned about what this will mean to low-income communities, the people that Jackson is supposed to serve and has served with dignity and grace throughout all of these years. And above all, the rape treatment center people, what's wrong? We're going to have an organization to gain profit from rape? That doesn't make any sense. You have relationships that have to be built. You have an outside entity to come in to do your emergency services. They have to coordinate with all of your other disciplines that you have in the hospital. That's not established overnight. That's something that has to be developed and it has to be nourished. And you cannot have people to come in from the outside and expect for them to be able to coordinate from the inside. Whether it takes courage, whether it takes compassion, but let's do what we need to do, whatever we feel the problem is with Jackson and its services through emergency, and to cut down the wait time. Let's do what we need to do to fix it internally. One of the things, and I apologize, Mr. Chair, for the time that I'm taking, but I really feel that this issue is much too critical to rush through it. My concern is that if we don't take the time to really look at the issues and really sit down with staff, and one of the things that we used to do in the county and that we still do, and that is have staff to sit down and say, okay, this is what we need to say. You all get together. We need to cut this amount of time off the waiting. But let's sit down together with the staff, with the unions, and figure out how we can best do that in order to serve the community more completely. While I am here, I want to hand board members a copy of a report that I received. And this report is on collections. That's another area that you're looking at. And I remember when the Financial Recovery Board, when the previous CEO was here, before the Financial Recovery Board actually, we're looking at privatizing the Medicaid, Medicare reimbursements. And eventually, I think you guys did, Chamberlain, Edwards, or something like that. And I remember the issue so vividly because the agency that you privatized to, and I think it's still happening today, all of the paperwork was being done by your staff, and they would take the paperwork and put and put their face sheet on it after your staff completed it and send it to Social Security. I didn't just take the word or the information that I received. I talked to the people in Social Security to find out. And that's what was happening. And you're paying $10 million that you didn't need to pay because you had people here who put all of it. To hand this information out to you because while you're looking at collections, look at what your own people are already doing. The month of October, they had a goal of $83 million. They collected $90 million. November, they had a goal of $83 million. They met and exceeded that goal by $83,600,000. And it goes on and on down the list, except 1 month. And they're honest about it. 1 month that they didn't do it. So I urge you, members of the board, you know, as an administrator, you always want to make sure that you're supporting your staff, that you're supporting your other administrative subordinates so that they can make key decisions. But there's one rule of thumb that you should always follow. Trust but verify. And make sure that the information that you're receiving is information you can make decisions on. And by all means, I urge you not to let anyone come to you at the last minute, because it's nothing so frustrating, and say, I want to give a no-bid contract to anyone without you getting information about whether or not there's competition out there, and can it save Jackson and can it help Jackson. So I'll close by saying to the members of the Financial Recovery Board, I had my reservations about the board, especially the makeup, because I felt that there was no one on the board who had had prior experience in the hospital setting or medical experience. And that to me was critical to the process. As we look now at the commission, which is going to be on the agenda in October, at whether or not we're going to continue the board as it is or restructure the board, those are the two areas that I feel that are weak and need to be incorporated. But I urge you, you have the power. Please don't abuse that power and ignore the comments of the people who are here today. Thank you very much.